Hi, Dr. Harrison here, and today I want to discuss the very important topic of headaches. Headaches are very common. I see them in the office all the time, but there are several different types. So I want to make sure you understand the different types. It'll maybe help you learn what type you have and how we go about treating those. So number one, and the most common type of headache that we see are muscle tension headaches. These make up about 90% of headaches, and they're usually caused by stress or tension in the neck and shoulders. We're going to find pressure around the base of the skull or the top part of the neck, and usually these headaches start in the occipital region and radiate around to the frontal region if they get severe enough. Usually these headaches are easily treated with spinal manipulation or adjustment to the neck, and that will help relax those muscles. Sometimes stretching or massage might be helpful for these patients. But usually they respond very quickly to care, and it's a pretty quick fix. Many times I'll get rid of the headache while the patient's still on the table. So if you feel like this is your category, don't hesitate to pick up the phone, call, schedule a free consultation. We'll see if this is what you have going on, and if so, it's a pretty quick fix for you. So muscle tension headaches make up about 90% of headaches, and number one cause of headache that we see. So the second most common type of headache that we see are cluster headaches. Cluster headaches tend to occur more frequently in men than women. They come kind of a sudden onset, and they call them cluster headaches because they come in small groups or clusters. So you might get a headache a day for 3 or 4 days, and then you might not have any for a few weeks. Usually accompanied with the headache, and these are pretty severe and sudden onset, you're going to get one-sided pain around the eye. And usually, many times we'll get tearing in the eye. It might affect the sinus on that side of the body, but usually it's either going to be right-sided or left-sided, a severe sudden onset. And again, these come in groups or clusters, hence the name cluster headache. The etiology is unknown, but again, typically we'll find that if we work on mobility in the spinal joints, so adjusting the neck, working on muscle tension around the neck and shoulders, many times will help reduce the severity or intensity and the frequency of these cluster headaches. So that's the second most common type of headache that we see. The next type of headache I'd like to discuss, and again this is a very common one that we see, are sinus headaches. Especially down here in Florida, a lot of people have seasonal allergies, or even worse yet, if you have infection, viral bacterial infection in the sinus, sometimes you're going to need antibiotic therapy, obviously to help reduce inflammation, kill off the bad bacteria that you have going on there to get rid of the headache. But outside of that, if it's just simple sinusitis or inflammation of the sinus membranes, many times that will trigger headaches. And those respond very well to pressure points around the sinuses, again, working mobility in neck and shoulders. And also I'm certified in acupuncture, and I have great results with acupuncture for relief of sinus headache or sinus pressure and drainage. So a great opportunity if you're suffering with sinusitis due to allergies or inflammation of those sinus membranes. Adjustments in the office, acupuncture work really well. Go ahead and give the office a call, and we'll set up a consultation, see what we can do for you there. The next type of headache I'd like to discuss are what we call rebound headaches. And rebound headaches are much more rare. I don't see them a lot in the office, but this would be for people who are maybe coming off of medication. Maybe they had a surgery and the doctors put them on a painkiller type medication that was somewhat addictive, or anti-inflammatories that were keeping the inflammation down. And when they come off of these medications, they get a rebound effect or a withdrawal type effect. Usually they're going to have headache, tension, things going on in the system that need to be calmed down. This is usually driven more neurologically, probably a sympathetic versus parasympathetic nervous system response. It's not so important that you understand the difference between parasympathetic and sympathetic nervous system responses. Just understand that when we do adjustments and work on the muscles and ligaments in your neck and back, we're reducing sympathetic stress and creating a parasympathetic response, which is more relaxing. And many times this will help with those rebound headaches. The last and most common type of headache I'd like to discuss are migraine headaches. Most people have heard of migraine headaches. They know that these are severe. but the definition would be if they last anywhere from 4 hours to 72 hours and you've had them at least 5 times in your life, then you would be deemed to be suffering with migraine type headaches. These are usually pretty severe throbbing type of headache. Many times people will have nauseousness, they'll have sensitivity to sound and light. They just want to go lay down in a dark room, shut the lights off, maybe put a cool compress over the eyes or around the head. Many times this will help, but sometimes they just need to go to sleep. These are headaches that are very difficult to eliminate completely. However, we've had great success in reducing the severity or intensity. Another thing I would like to add about these headaches is sometimes the patient will sense them coming on prior to the headache. They call that an aura, where they kind of just get this sensation that the headache is coming. If you can get to the office early on before the full-blown headache shows up, many times adjusting, stimulating the parasympathetic nervous system will calm things down and we can avoid that long protracted headache or migraine. So, and on the outside of that, even if you've had these for years, like I said earlier, many of our patients respond very, very well to a series of adjustments. We reduce the intensity, the severity, the frequency of these types of headaches. So don't hesitate to call the office. No matter what type of headache you have going on, we help patients with this all the time. Call the office, set a free consultation. We'll figure out what type of headaches you have going on, and we'll talk about a solution as to how we can go about treating this and getting rid of these headaches, or at least controlling them and making them much more tolerable for you. I hope this information helped, and I look forward to speaking with you in the office.